Hi, I'm Chris Swain, and I'm here today at Fisher Swale Nicholson Eye Center talking to Dr. Jerry Swale about an exciting vision correction option called Visian ICL. Well, hi, Dr. Swale. How are you?
Good, doing well, thank you.
So much. First of all, I just wanted to let everybody know and disclose the fact that I had LASIK surgery from Dr. Swale, and it was one of the most amazing events that has ever happened to me in my life. I'm telling you, 6 years ago, it was just, my life was, it was all about contact lenses. It was all about glasses and trying to find my glasses and going to sleep with my glasses on. It was just a nightmare. Working out with my glasses and slipping, you know, you've heard it a million times. And so after my surgery, my LASIK surgery right here at Fisher Swale Nicholson Eye Center, it was life-altering for me. And I just can't believe that there's another procedure out there that's growing in popularity like LASIK surgery. Tell us about it.
Yeah, it is growing in popularity, the Visian ICL. The Visian ICL is a tiny, much like a contact lens, but unlike a contact lens, it sits on the surface of the eye and is exposed to the elements and collects protein and mucus and causes irritation. This implant goes inside the eye. It adds the correction that a patient needs, the focusing power that a patient needs, but it's inside the eye, protected from the elements. It's essentially maintenance-free. It doesn't have to be removed and cleaned. It's put into the eye in a sterile procedure, and it permanently corrects people's vision.
How would somebody be a candidate for this? Because obviously not everyone out there is a candidate for LASIK. I guess what are some of the options?
Yeah, well, LASIK is an option, and initially the Visian ICL was used as an option for patients that weren't eligible for LASIK. Patients whose corneas were too steep or too flat or weren't shaped right or too thin. Those patients had an option to have the Visian ICL implanted. But it's worked so well for those patients that we've really expanded the range, and now we're using the ICL even in lower degrees of nearsightedness. So patients, some patients have an option, either LASIK or the Visian ICL.
Well, I always want to know about downtime. I mean, everybody's so busy and time is so precious. Everybody has families and people have work, obviously. I mean, what is the recovery time after this? Is it almost immediate?
Well, the improvement in vision is immediate. And, you know, in fact, that's one of the most enjoyable things about implanting the ICL. People with extreme amounts of nearsightedness, the second they sit up, they can see the clock across the wall, they can see the second hand on the clock, they can tell the time. It's a very, you know, for some patients, a very emotional experience because suddenly they can see without the aid of contact lenses or glasses. You've experienced that with LASIK, you know,
Sure.
The immediate improvement in vision it's exciting. In terms of downtime, most people are able to return to work the next day.
So what exactly is the procedure when you're actually performing this? What exactly is it that you're doing?
Yeah, well, what we do is sedate the patient so they're comfortable, not just a light sedation, just to relax them a little bit. We bring them into our accredited surgical suite, which is a sterile room where the patient lies comfortably on a bed, play some nice music for them, make sure they're comfortable. We prep the eye, use sterile drapes, sterile instruments, sterile techniques. It's all performed through an operating microscope. Very tiny incision is made in the eye. The implant is placed into a cartridge. It's rolled into a cartridge, inserted into the eye where it gently unfolds. The ICL implant is tucked behind the iris where it's cosmetically invisible. No one will ever see it in your eye. Once the lens is in position, we put some sterile fluid in the eye, seal the incisions. No stitches are necessary. In fact, I've never used a stitch on an ICL patient. And then the procedure's done. We then go to the other eye. After prepping that eye, use separate sterile instruments, sterile solutions, perform the procedure on the second eye on the same day, and the procedure's over. We then sit the patient up, and they, for the first time in many, many years, decades sometimes, they're able to see without the aid of contact lenses or glasses.
Well, Dr. Swale, we know that you're definitely committed to this. And we're going to put all the information on our website so our viewers can go out there and find out if this is right for them. And find out also if this Visian ICL thing there could be a candidate for this as well. And we certainly thank you very much for your time.
Well, thank you, Chris. I appreciate it.